Chapter 3, Clinical Bucket. Okay, so you already know clinical really well. You're probably really good at it. It's talking about patients and pathology, doctors and nurses, and how they approach a patient population. Could be surgery, could be somebody in a clinic, could be somebody with a cough. Doesn't matter, right? You're probably really good at it. You probably can go very deep on your product and the problem. So deep, in fact, you confuse the administrator or the business person. And that's the most important key on a business case from a clinical standpoint. You and your doctors can go hours on the problem and the solution, but nobody's going to listen to it and nobody's going to understand it if you don't keep it simple, easy to understand, and it should pass what we call the spouse test. Assume for a second your spouse doesn't do what you do, doesn't understand clinical, is just somebody who wants to learn. How would you teach him or her what you're talking about so that they would understand it? But if he or she can sit across the table and say, oh my gosh, I didn't understand, I didn't realize that that put patients at risk. I didn't realize how hard it was for doctors or nurses to do that. And to do that, you've got to keep it simple and easy. It's not dumbing something down, it's simplifying so that anybody could understand it given 20, 30, 40 seconds. And that is extremely difficult. It's difficult for nurses and doctors to do. It's difficult for salespeople, I have found, to do. So, can you take several steps back and explain the problem simply so that that person understands it? Here's how simple I'd be. This is your neck. These little bumps are the back of your neck. Surgeons take kerosins and put them in and chop away bone and ligament and soft tissue. Now, needless to say, that's your spinal cord and canal. This is a very sensitive but workhorse instrument. So things get stuck in it as you're cutting and removing. It gets jammed in here. And we're trying to be very finesse. This has taken decades of design to perfect. So you don't want to be introducing something that's in this into another patient. And you certainly want this thing to cut repeatedly, sharply, and you can understand why surgeons get frustrated. This is a cutting device that removes bone and ligaments from your cervical spine, your neck. So hopefully, heaven forbid, if you happen to be my spouse, you would understand what these instruments do, where they're being used, what their intent and purpose is, and how functionality on it is very important and why they're difficult to reprocess.